Hi, everybody, and thanks for joining us. Just to quickly, I'd just like to thank Sally, Kirsty, Bob, and Tom from the PHN for making this such an easy process. When I started out with Telehealth and with Health Direct, it was super easy just to register and take it from there. But more importantly, I'd just like to point out, like Jude, Jody, and the other team at Health Direct, the support is fantastic. I mean, I've never had a problem not getting hold of someone. If they haven't answered the phone, I've sent them an email and they've always got back to me on that same day. So if ever you've got any questions, if you can't log on, if any of your patients have difficulty logging on, they need some hand holding, support at Health Direct is fantastic. So basically my aim for this talk is that I'm hoping at the end of my talk, you'll all be very comfortable using telehealth video consultations. They're easy and they're great fun. As far as I'm concerned, in my practice, when we use the word telehealth, we talk about video consultations. We're not talking about phone consultations. It's a specific, I think it's a vernacular we should change, because I think telehealth should really specifically be referring to a visual video consultation. There are lots of pros. I'm going to run through a few pros and a few cons. The lots of pros is, first, it's really easy and it's efficient. And by the time I'm finished talking today, you'll be confident that it is easy and efficient. It's actually much, much, much faster than seeing a patient face-to-face. Getting out of your chair, going to the waiting room, calling them in, seeing they're not in the waiting room because they're a bit COVID phobic and they're sitting in the car, so you've got to find which car they're in. It's so super quicker to use a video consultation or Health Direct than actually in reality, having them face-to-face. The other thing is, it's obvious that Medicare seems to be moving away from phone consultations and we can't do mental health plans. You need to do either a video or a face-to-face. For management plans and team care arrangements, my understanding is you need to either be a video consultation or face-to-face. You can't do those through the phone anymore. And also you can go for long consultations. I had a 50-minute video consultation yesterday. So it's far more in line with what we really do in reality. Personally, I found counseling much more rewarding on a video consultation than in face-to-face. I find adolescents seem to be far more comfortable in the safety and the confinement of their own space. They open up more, they're more comfortable, and they seem to enjoy the process far more. Often spouses join in. I had a patient yesterday morning he's always come by himself to the consultations. I've never seen him with his wife in the same consultation. And yesterday I was dealing with his out-of-control diabetes control. I was wanting to increase his Jardiance and his Jardiance. And then his wife puts her head in the door out of the blue and says, "Have you spoken to him about his diet? He's been eating a lot more bread and fruit lately." So there's a lot of things that happen during a video consultation practically that make it far more useful than having just him sitting by himself with me. You don't need a mask. You can see their face, they can see your face, you can breathe air properly. It's much better consulting without a mask. There's lots more nuances you can pick up. Also, we're all fearful of that asymptomatic patient that comes in for a blood pressure check, and then you get a health department phone call the next day or 2 days later saying, "I'm sorry, you're going to be locked up for 2 weeks at home." This is the time where you need to perfect your video consultations. I don't think we should wait until you're in lockdown at home because your patient came in who happened to be COVID positive at the time without knowing it. So my advice to you is embrace video consultations, because if, God forbid, you're in lockdown, you'll be easily able to just continue working from home, doing video consultations as if you were sitting at your surgery. Also, you can use it for other things. While I'm doing my video consultations, I'm uploading to my health record at the same time. In best practice is Shift F9. It's easy. It flows very easily, and I'll show you how to do that. Another thing is that when Jude was talking about having more than one person in the consultation, I've used it a number of times for return to work conferences, meetings with employer. But mainly, like if you look at return to work conferences on TAC and WorkCover, there's quite substantial reimbursement for that. And it's really rewarding. You don't have the OT or the physio sitting in your waiting room with the patient for half an hour while they're getting frustrated. You just send them a message when you're ready. They come in, they join, the patient's there waiting for them as well. And you can have a full functional return to work conference. It works really well. The other good thing about video conferences is that at the moment when people are in lockdown, like we are in lockdown, that 12-month rule does not apply. You don't have to have seen the patient in the last 12 months. So at the moment, if you've got a patient who you haven't seen for years, my understanding is you can do a Medicare consultation as a video consultation because we're in lockdown. The cons are very, very basic. And the cons to me is, number one, sometimes I get very, very comfortable doing, and they're very long consultations. So the consultation time can blow out. And secondly, often I forget to make notes because I'm getting carried away, the patient's getting into it. So you need to be cognizant of the time and the fact that you need to make your notes after each video consultation. So what I want to achieve today is, number one, how you can get the message through to your patient, how the telehealth consultations work. Number two, how the patients can log into your virtual waiting room or just come into your virtual waiting room. And number three, how you can easily use Health Direct more effectively. And I'll give you some tricks and tips that I've managed to develop over the months. So the way my system works is that at my surgery, the receptionist, when they're making the appointment, always puts it down as a telehealth, not a telephone. And the patients are well aware that this is going to be a video consultation. They're going to get a text message or an email and they just follow the prompts. That's the main thing they're told. Then I'd like to share with you my desk setup, how I set up my desk, how I set up my camera, because there's some tips there that you might want to take on board. Then I want to share with you how you invite the patients into the waiting room, so how they know how to come into your waiting room. And there are two ways that I use to message the patients about when they can actually log into the waiting room, come into the waiting room. And then I'm going to show you a few enhancements that Health Direct offers you and how I set up my computer screen. The way I set up my computer screen with every single telehealth consultation is on the left-hand side of my screen, I see myself and the patient. And the right-hand side of my screen, I have the patient's notes. So I'm making notes, I'm sending e-scripts, I'm emailing them their results, all at the same time while I'm actually looking at them on the left-hand side of my screen. It's easy to do, and I'll show you that briefly. So basically, the first thing I want to show is inviting patients, and I'll show you a quick demo of my ways of inviting patients. And the second thing I'm going to show you what the patient sees, what the patient goes through when they are trying to come into your waiting room. Okay, so the way I invite my patients into the consultation or to send them the message, there's two things you can do. And I apologize if this seems a little bit complicated initially, but it's actually really simple. If you do it once or twice, it's easy. If anybody who's listening today wants some more advice from me or wants to contact me for any questions, I'll be more than happy for you to come to me directly or to go through the support people. But I hope I'm not going to make it sound look too complicated, because it's not. So I use best practice, but I'm sure Medical Direct and all the software packages out there do the same thing. So you can send text messages directly to the patient from your software. So for example, this is a dud patient named Jeff Practice. Now, if I want to, I'm ready for Jeff. I want him to arrive in the waiting room. It's time for his consultation. I go to my message utility in best practice, and I've got a template. You can have a number of templates, but my primary template that comes up first is my Health Direct template. And what I do is then I send him a text message within best practice, and that's been sent now. And he gets a text message immediately, and he goes into the waiting room. That's the one way you can message him. You can send a message from best practice directly. That's the only issue with that is the messages that you send in best practice need to be a bit concise and small, because otherwise they charge you more per once you go over 160 characters. So another trick that I use mainly is, and this might sound complicated, but it's not. I go to my word processor, and I've got a template at the top of my word processor that I double click on, and it's just it's a template that puts their mobile phone number at the top, and then the steps, one at a time, what they have to go through. I highlight that, and I cut it. I get rid of that document, and then I go to the Health Direct platform that you see here, and you see it says send an email or send a text message. I click on ping a text message. I paste in their phone number, and I paste in the message, and I click send message. This really takes about 10, 15 seconds. And now that message has now been sent to the patient. It's a longer message. It's clearer. There's more steps. That was a text message that just come through. Okay, so those are the way you can tell the patient time to come in to your waiting room area. I also sometimes send emails. There's a way of sending emails as well, but I won't go into that now. So what the patient sees on their phone or on their computer, whatever they're using, is this is what comes up. They click on the link in the message and it takes them to that. And they're going to follow the steps. They start the video call, and now you won't see my face there because my camera's being used for the Zoom that we're on. But I'll just put his name. His name is Jeff. Practice. And they set the terms and conditions and they click continue. Okay, continue. And then what happens is they now get this message. Okay, and the message says, this is all it's been set up for my practice. This is, thank you for arriving at Macedon Medical Centre waiting room. Please be patient. Your doctor will be with you shortly. Please keep watching the screen. Please press the triangle below and listen to the message. And it's been interesting. I've been doing an audit, and every single one of my patients that's been coming in the last week have actually done this and listened to the message. So I'd like to, this takes about 30 seconds.
Hi, this is Dr. Zulman speaking. Well done on reaching the situation where you are now. That means you know how to use the system. Please do not touch your phone or your computer, whichever you are using for this, and please keep an eye on the screen, because there will be a message coming up soon that asks you to share your microphone and your screen, and all you need to do is click allow, and that will take you into the consultation. The doctor may be busy with a patient at the moment, and that's why there's sometimes quite a bit of a wait. It could be 5, even 10 minutes, but we know that you are there. So please just wait, be patient, and we'll be with you soon. In the meantime, there's some really great music for you to listen to that will follow this message. Thank you, and your doctor will be with you soon.
So the benefit to me of having that recording is that if the patients have to wait, at least they know they're going to wait. They've got some music to listen to. The message takes a while. And I had a couple of patients that had to wait a very long time. Yesterday morning, I was stuck in another consultation for a while, but they knew they had to wait. So now that's what the patient's finished. They're now sitting waiting. What you will see on your computer is this. You will see there's Jeff Practice is the patient. He's been waiting for 2 minutes, and you now can invite him into your consultation room when you're ready. If you know you're going to be a long time, and I use this all the time, you can send a message. It says notify there, so you click on notify. You can type in, hi Jeff, I'll call you soon. And then you send that, and that'll flash up on his phone or on his computer. So he knows you're still there. He's aware that you know he's going to stay there. When you're ready, you click on join call, and Jeff will come in to the waiting room and into your appointment room, and the consultation starts then. So that's that. Coming into the consultation. So I'll just quickly, briefly again, my staff note tells them it's a telehealth. They're going to get an email or a text. They know, they explain, they've got to follow the prompts. Quickly, I'd like to share with you just how my desk is set up. It's very important to have good eye contact, especially if you're doing a lot of counseling. I do a lot of counseling through Zoom. I do a lot of methadone, so boxone work. A lot of it's done through Health Direct. It works amazingly for methadone patients. I can see them. They're at home. They never miss their appointments, because I can find them. Even I had one patient who was walking a horse through the fields, and I sent her a message, and she logged in, and we had the consultation while she was walking a horse around. So your patients, so basically you need good eye contact. So you need, like for example, now you can see I'm getting good eye contact with you, and because I'm looking at the camera. So the way I've set this up is I've actually got my cameras on a stand that sits in front of my computer screen, and I can move away to the side quite easily. There's my friend Russell, who's posing as a patient. And what I've set up is like that. There's my screen. On the left-hand side, my patient. In front of the patient's face is my camera. So when I'm looking at the patient and I'm doing a consultation, the patient feels that I'm looking intently directly at them. And on the right-hand side is the patient's notes. That's just a photograph from the side. You can see how my camera sits, and it's easy. I just pull my camera out of the way, or I can just lie it down. So the benefits of Health Direct, there are many benefits, but the main one to me is it mimics exactly what's happening in reality. I've got my virtual waiting room in Health Direct, and I've got my real waiting room out in the waiting room by the front desk. And I know who's who, I know who I'm going to call in. They listen to music, they know when they come in. It actually mimics the normal flow exactly. Inviting patients in with a text message or with an SMS, like I said, email, they know. It's very, very rare that a patient, I'd say one patient a week doesn't come in and use the system properly. So finally, I'd like to share one more thing, and that's my screen, all right? So in terms of the screen, if you look at your keyboard, you'll see there's a window icon on the left hand, in the left side where that arrow on the photograph is, and the right hand side there's a left and right arrow. So if you hold down that Windows icon and hit the left arrow, everything on your screen will move to the left. So for example, that's my screen. If I hold down my window and my left arrow, it all shifts to the left. This is my patient's notes. If I hold down my window and my right arrow, it all shifts to the right. When I put them together, that's what my screen looks like. My patient's in front of me, I can see myself. On the right-hand side, their notes, I can do everything I need electronically, and it makes for a beautiful, easy virtual consultation. Thank you very much.